What is going on, beautiful people? I hope you are having an amazing day. Welcome back to another episode of the Thrive Forever Fit Show. I'm your host, Jay Nixon, and if you know anything about me or you've listened to this show for any amount of time, you know that my goal is to help you live your happiest, healthiest life while on the quest to cure obesity. And I just want to say from the bottom of my heart, I am immensely grateful that you spend your time listening to me rant and ramble about all things health, wellness, abundance, and opportunity. It absolutely means the world to me. Today's episode is sponsored by my brand new weight loss transformation program called Flex. Flex stands for a flexible lifestyle eating and exercise program. And my promise is this: it will be the last program you ever need to purchase. It is a weight loss program that is not a diet. I know that just blew your mind. This is not a diet. There's no pills, potions, or false promises that you have to purchase. There's no fad, no covers of magazines, no doctors in lab coats. This is real deal lifestyle transformation that is going to change your life forever. You will never need to do another diet. You're going to get expert level support and accountability. You're going to get transformative information about how to eat, when to eat, what to eat. There's 3 reasons that people struggle with weight loss. It's too much, too often, or the wrong combination. They're either eating too much food, too often, or they're eating the wrong combinations. And I'm going to help you fix all 3 of those. Thousands of people just like you have ditched the depressive diet roller coaster, have come on board with the Thrive Forever Fit Flex program and are transforming their lives. We've got clients that have lost 10 pounds in the first 7 days, 15 pounds, 20 pounds. We've got clients that are over 130 pounds down. Guys, I promise you, this is the last program you'll ever need to purchase. And I am more than honored to offer it to you so that I can help you on your journey. All right, let's get to the show. My guest today is an absolute rock star, Dr. Mike Sinel, Dr. Mike for short, completed his residency at Cornell University Medical Center, Memorial Sloan Kettering in New York. UCLA School of Medicine is where he's privileged to work closely with medical professionals of all different facets. And I say all that to say this: the dude's smart. We're about to have a high-level conversation, which I absolutely love. Dr. Mike's going to talk to us today about how nutrition is the best medicine for curing and preventing chronic diseases. Guys, you know this is right up my alley. I love highly intelligent humans who have a purpose and passion for helping people live better lives. And today is absolutely no exception. Dr. Mike is going to blow you away. You're going to absolutely love this. Tune in, get ready, saddle up, get a pen, get a paper, get a beverage. We're about to have some fun. Here comes Dr. Mike. Dr. Mike, welcome to the show, brother. How you doing?
Good, excited.
I am super pumped. And we had a little chat before I hit record, and you and I are birds of a feather. We believe the same with, trying to help people and, the minimization of unnecessary pharmaceuticals, we'll call it, and the proclamation of foods and food products to help heal people. Tell the audience, I know about you, tell the audience a little bit about your background, how you got to where you are today, and then we'll kick everything off.
Sure, thanks. Yeah, grateful to be here. So yeah, trained as a medical doctor, did a residency at Cornell Hospital and Sloan Kettering in New York. Trained in physical medicine, rehabilitation, and pain management, and ultimately, went into musculoskeletal outpatient pain as a focus, sort of like the non-surgical side of orthopedics. Specialized in spinal disorders as a primary thing, a lot of neck and back problems, herniated discs, and, became a assistant professor at UCLA where I taught for 30 years and was always trying to bring holistic messages to patients, because my partners were all spine surgeons in a large spine institute. And my goal was, well, if I can manage people non-surgically with alternative approaches. So we had physical therapy, chiropractic, psychology, acupuncture. I was always saw medicine as integrated care,
Yeah.
and, in my teaching at UCLA, I was a bit of a yogi. I brought yoga therapy into the medical school. I brought mindfulness meditation into the medical school as courses, and tried to bring all those things to my patients because, many diseases have to do with our nervous system and lifestyle, etc. And and also, listen, I was traditionally trained in Western medicine. I had pharmaceuticals. I prescribed a lot in my life, but I always sought them as, if there's another option, great, and try to minimize prescribing of them. Just like I try to minimize recommending of surgery. Occasionally you need it, right?
Yeah.
So try to treat my patients how I would treat myself, which is, lifestyle, nutrition, proper diet, exercise, food. No news, something we all know. So yeah, I came out, I ran a department at Cedars Sinai, taught in UCLA, was partners in a big spine institute, and came across, I had a number of clinics actually also with chiropractors in the clinics, and they were integrated clinics. And I came across these medical foods, which I never heard of the category, which was interesting to me because I'm out there teaching in the fields of orthopedics and pain, and what are medical foods? I figured they were green drinks or bars, and these were actually encapsulated products. So I was like, wait a second. I know of supplements, I know of OTC meds and prescription pharmas. So here's encapsulated products called medical foods that are FDA regulated. And some of my colleagues who are pretty prestigious docs, the chief of rheumatology at Cedars, other UCLA professors, were all prescribing them. And I'm like, okay, let me dive in. And as I'm talking to them, they're like, wow, these have published human trials, double-blind published studies against things like ibuprofen and naproxen for chronic pain and inflammation. I'm like, wow, I have literally hundreds and hundreds of patients taking various non-steroidal anti-inflammatories, and certainly ibuprofen being the most common in the world, right?
Yeah.
I'm saying, and I also always knew these things had a lot of side effects: gastrointestinal, bleeding, cardiac, kidney. There's endless amounts of side effects of non-steroidals, but many people need them. Many can't tolerate them. You look at the world of arthritis. So I said, well, we have natural products that the FDA regulates with published studies against an ibuprofen, naproxen. I want to dive in quickly on that. So I read the studies. And then I found out they had not only chronic pain and inflammation, but they had studies against trazodone for sleep with another medical food. That was one of the most widely prescribed sleep meds in the world.
Yeah.
And, I treated pain, musculoskeletal, wide-ranging type of patient profile. So I had lots of patients with chronic sleep problems, chronic pain, chronic inflammation. They had another product for neuropathy. So obesity, cognitive decline, fatigue. I had a lot of fibromyalgia in my practice. There was a protocol with 3 different medical foods. So I come to look at the category, and if you don't mind, I'll define what the category is.
Please do.
Yeah, for the FDA. So basically, the FDA defines the category as all the ingredients of GRAS, which means generally recognized as safe. So they were all natural products. These products, in particularly with these companies, were basically amino acid formulations. They had a patented messenger amino acid technology, and they were amino acids in a variety of botanicals that could produce neurotransmitters and basically balance neurotransmitter deficiencies that turned out to be associated with all these chronic diseases. So I'll come back into that in a moment, but let me go through the FDA definition. So anyway, GRAS ingredients, which means generally recognized as safe. So it's natural products. CGMP manufacturing, which means very high standard manufacturing, right? The next category was they had to meet a nutrient deficiency that was found to be scientifically proven in a disease state that cannot be met through a normal diet. So that was a big scientific threshold there. Like in a disease state, you have to prove that there's a deficiency at a cellular level that you can't meet through a normal diet. This company and these products have done a wonderful job. And it turns out in many diseases, because of the increased metabolic demands of the disease state, like if you look at chronic pain and inflammation, right? You can imagine the body's working harder at a cellular level, right? It's like a car running uphill is going to use more gas, or my Tesla will use more electricity, right? I'll get much less projection.
Right.
So it's actually demanding more nutrients. And it turns out there's a relative deficiency of neurotransmitters at the cellular level. And neurotransmitters are signaling molecules throughout the nervous system that are telling cells how to operate, right? So turns out in chronic pain and inflammation, there's a deficiency of these neurotransmitters. So it's affecting how the pain signals are transmitted through the nervous system. And when you replete those deficient neurotransmitters by providing, in this case, these amino acid precursors through this technology, balancing the neurotransmitters helps dampen the pain signals and slow the transmission of pain and inflammation. It was really fascinating to me. So, you know, the last threshold of the FDA category was it required physician supervision. When I came across these products, they were all prescription only. Now, the FDA re-regulated the category. So, and now I've acquired the company since, but we have physician supervision on the label, right? And someone should be under a physician's care for their pain or inflammation, but we're able to sell them direct off a website. We're a licensed pharmacy. And so we can provide these products for pain, inflammation, sleep, neuropathy, cognitive decline, fatigue, many human clinical trials for many years, 40 million doses safely prescribed. I used to prescribe them for many patients and slowly take down the amount of prescription pharmaceuticals or over-the-counter pharmaceuticals they may be taking. Sometimes I could get them off the meds completely. Sometimes I could reduce the dose in half. One of the big studies showed you could reduce naproxen by 70% if you combine it with theramine and get the same effect. But if you reduce the dose of the pharmaceutical 70%, in that case, you're eliminating like 95% of the side effects.
Yeah.
So yeah, I got excited, started prescribing, and went on to ultimately buy the company because it used to be a prescription only insurance reimbursed company. They were trying to get Medicare approval. That no longer exists. They were $400 plus a bottle. I now have them retailing at $60 a bottle through our online pharmacy. And we're selling it through practitioners, pharmacies, etc. So my goal is to educate the public about these as much as possible and hopefully help them get off pharmaceuticals for more natural substances, or at least lower the dose when possible of pharmaceuticals with a natural option that's working through the nervous system with the nutritional approach. So I'll let you go. And
yeah, I think that's phenomenal. I mean, that's right in alignment with, you know, everything that I would be teaching and preaching. I wrote down a couple of things when you're talking. A few things to unpack is I would consider you to be a medical outlier, if you will, just from your belief system of how you kind of taught and how you prescribed and how you thought about medicine combined with the body and surgeries and everything. But take me back as far as you can remember as to, you had to be a little bit different in the way you approached patient care as all of your colleagues. How did that come about? Like, were you always that way, or?
No, thanks. I mean, that's a great story. So I guess, you know, so I was a psych major undergrad and, you know, so I was really into the mind-body connection and pain, and also knew myself when I was stressed, you know, I'd get all sorts of skin stuff or gastrointestinal stuff. So mind-body medicine became like something I knew. And so I went into physical medicine rehab because it was a very holistic field. Like, look at the patient as a whole, look at their situation, their job, etc. During my training, I met John Sarno, who was a guy who was sort of the leader in the world of stress-related back pain. He was a professor at NYU, wrote some very famous books. I started spending time with him. I was at Cornell, he was at NYU, we got acquainted. I was sort of spending a good chunk of my time learning about him, telling people a lot of back and neck pain is stress-related, and I'm sure most people understand stress could cause lots of symptoms. It dysregulates our autonomic nervous system, our flight-fight response. And turns out that plays a role in almost everything, especially many chronic diseases. So during my residency, here I am having a part-time mentor as the guy, like a tenured professor, is a leader in the world, going against the grain of medicine, but getting thousands of patients better with back pain, telling them, think psychologically, not physically, look at your lifestyle, etc. So I started off my career very much like that. Now, when I went to practice in Beverly Hills, it was very interesting because that population, it was LA coming from New York. People are open to everything.
Yeah.
And I was open-minded. I started practicing yoga, feeling energy in my body, learning about my chi, right? Leading this different lifestyle from Manhattan. And, my patients were coming in, doing everything, acupuncture, Feldenkrais, like Reiki healing. So I had a very celebrity practice, frankly, in Beverly Hills. So when your patients come in and they're like, could you talk to my acupuncturist? Could you talk to my Reiki healer? Could you talk to my massage therapist, my hypnotherapist? You're talking because you want to help them and you want to communicate as a team, which was the nature of my field. And my curiosity just got me to learn all this, because I'd say to this practitioner, like, well, if he's taking care of all these known celebrities who could go where they want, and really affluent populations, I'm curious and I wanted to understand what he was doing. So I started getting exposed to an endless amount of alternative practitioners who were like the top ones in Los Angeles. And they'd all say, hey, we'd love to meet you. Could we sample what we're doing on you? Because we'd love to take care of your patients. So slowly but surely, I really became someone in the community who was like allied with, from chiropractors, acupuncturists, psychologists were always part of my mind-body practitioners, exercise physiology, started learning a bit about nutrition just because, again, in my own lifestyle, watching what I ate compared to what I grew up with started playing a role. And it became an interesting journey, learning from my patients, learning from practitioners in the community, and balancing that with, getting an academic appointment in UCLA and playing this like, wow, Western medicine is really challenged, treating symptoms, you're hypertensive, let's lower your blood pressure and keep you on medicine for life. So I was like, there's something missing here. Then I had some friends early on going into functional medicine, which was like looking at root cause, like, hey, instead of just treating the symptom, why don't we see what's causing it? I'm like, well, how is that not an obvious thing? But it's not Western medicine. And, I went on to actually own surgery centers in a hospital and really saw how Western medicine, economics was a very, very big driver. I mean, the pharmaceutical industry, God bless them, they save a lot of people with a lot of great things. But then again, there's a lot of real challenges to say, hey, just stay on this med and regulate your symptoms, when we could, medicine can go deep underneath with root causes and get someone better and get you off a med that has a lot of side effects. So it became a lifelong journey, and myself trying to never take a med unless it was the last resort, which I needed them at times, had a surgery here and there on an elbow, but, became like always East-West medicine, integrative clinics. I practiced with chiropractors, acupuncturists, massage therapists, and then these medical foods became like, wow, nutritional natural meds that the FDA actually regulates. that have big science and human trials, how do I not try them on everyone? And, as they became, increasingly adopted and efficacious in my view, and no downside risk, I just started spreading the word about them and went on to buy the company. And my goal is to really get this out as a big movement. So, and this is very early in the game, so I'm glad we're talking.
Yeah. How did you transition that? Because I think, growing up, like I'm 48, almost 50. When I grew up, like if the doctor in the white lab coat said it, it was just the gospel. That's kind of how my parents were raised and things of that nature. How did you get the patient to think differently? Because, I think most people are used to being prescribed a medication, but when you were prescribing them like for lack of a better term, a food source, like a real, living, breathing alternative, was that easily received, or was there like, are you sure, doc?
Yeah, well, again, so it's interesting. So it was in LA, so I never didn't have patients asking about supplements, right?
Yeah.
Patients were coming in, hey, what do you think about glucosamine and melatonin? So LA was sort of always unique, right? With like going into the alternative field. And then, I wrote books on back pain. I wrote the dummies books. I had pretty big academic credentials as a UCLA professor, and had a celebrity practice. So I also utilized that, like I was the white coat, right? So, so when I learned about it, and I would say to patients, listen, this is a good alternative option. And it was also very easy for me to say, look, I have good science on this, but the bottom line is there's no risk for you. If it doesn't work, it doesn't work. Like for me, everything as a doctor is a risk-benefit analysis, right? And I'm saying, look, one thing I can tell you, these are amino acids and certain botanicals, and they're not going to hurt you. We're working on your neurotransmitters, trying to balance them. If it doesn't work, it doesn't work. But why not try them? Because if it works, I can bring you down on some of your meds. I have you on meds for neuropathy or for sleep or anti-inflammatories or occasional opioids. I know they have lots of side effects. I know you're at some risk. Why don't we try these? And if they work, we'll see if we could start weaning them. So yeah, patients were real receptive. And frankly, I can't imagine anyone out there, like when I speak to the public, and I used to educate doctors on this, if you have patients taking something for arthritis or chronic back pain, right? We know percentage-wise that it's a reasonable likelihood they'll get some side effect over time with chronic use that is not good for them. And if I have something perfectly safe and natural, why wouldn't you try it? Like there's no reason. They may waste a few bucks, right?
Yeah.
But
agreed.
It improves their health. It's just like, why would you not exercise and eat right? It's the same thing. It makes no sense. You have type 2 diabetes. How could you not do the lifestyle changes, the nutritional changes? So
Totally.
yeah, I think it's an easy sell. And when I'm passionate about something, this is why I went on to buy this company. I'm like, the world has to know about this.
Yeah, I want to stay on the topic of pain, because I think that's a massive, category of pharmaceutical, right? I think a lot of people, as humans, we want to avoid pain and gain pleasure, right? And so if we're in pain, we want it to go away. We want it to go away quickly. How do you see this used, and how did you use it in practice? I mean, you obviously, there's a massive opioid crisis that's still in play in the world, in the United States today. How were you able to convince someone of a natural product when they had maybe been on something that was maybe a little harsher or a little more, instant gratification?
Yeah. And it was good because I was the one writing the script for the other stuff, right? So, I had a bit of control there, although there were always other doctors. But I will say, I would explain to the patient, hey, we could add this on. There's no downside for us adding it on. I'm not going to change your meds in the beginning. And then let's see if we can slowly bump down some of your meds, because these are the risks. And if it doesn't work, it doesn't work. So I'm not looking to take you off your meds. It just was very commonly working. And I'd show them the science behind it, right? And I would explain, look, pain in particular is also a disease of the nervous system. We all have different pain thresholds, get transmitted for the spinal cord. It gets going through different pathways in the brain. It gets interpreted, at a cortical level into what an emotional feeling you have. So I would say it's very complex. Chronic pain can be modulated centrally by how you think about it, the meaning you attribute. That was a big part of my work, right? Changing how people relate to and see their pain. And we'd also use, just like we could use hypnotherapy or biofeedback, right? Or distraction techniques. So I was always doing a lot in pain, right? Like to try and reduce medicines. Because if I could use acupuncture or hypnotherapy or biofeedback, I would explain to the patient, this is safer for you. It's not attacking your kidneys or your liver or your GI tract. So, when you explain it rationally and you're wearing the white coat, they would understand it. And I'd say, now we have these amino acids, which are going to change some of the neurotransmitter pathways, and GABA will help dampen things, and acetylcholine and serotonin. There's all these neurotransmitters, but they are interacting in a very complex fashion. And it turns out in your chronic pain, some of them are deficient. This is just something we know scientifically. And in your case, it's not like we're going to check your lab levels of neurotransmitters, but we have something here that is shown to work in a lot of patients in clinical trials. So let's try it and see if we could cut down your pain medicines. And that was the whole thing. And then I started recommending them to many, many hundreds of docs around the country. I went on the podium with this when they were prescription only and turned hundreds of practices onto it. Most of them at the time, a lot of them were integrative practices, medical doctors, chiropractors, because they were more open in the beginning to integrative approaches. Yeah. So that was the pathway I went down.
I was going to ask how you were received from your colleagues, and then also as a professor at with that in the academic setting. I know you're not just up there talking just about this kind of thing, but like, how was your philosophy of the mind, body, use food, use these non-pharmaceuticals, and use pharmaceuticals where applicable? How was that received in both those from your colleagues and then from the academic standpoint?
Yeah, I mean, better in the last 10 years than the first 20.
Yeah.
I mean, there's an increasing shift, right? And an acceptance. And it was always received well with the public, 90+% of the time. But practitioners, look, there was always old school. Mm-hmm. I tended to be more progressive. And again, I would tend to speak to the people who are more receptive. So integrative doctors. And I also was well known because like the first book I wrote on back pain was an integrated mind-body approach. Okay. So I was out there speaking about it and bringing yoga therapy into a med school. And, and there was increasing research over the years. I mean, meditation as a modality, yoga therapy as a modality in medicine. And then at the same time, we saw the supplement world booming over the past 30 years. And, challenge with it was unregulated. So it was really a marketing game of claims. It was a lot of good supplements, but very hard for the public to discern what worked or what's in them. I mean, the medical foods are like FDA regulated with CGMP manufacturing. So you know what you're getting. It's pharmaceutical grade. So that was part of the story. But practitioners couldn't deny the human double-blind clinical trials of these particular products, which made me super excited. Like Theramine for pain, there's 30+ million doses and big studies against naproxen and ibuprofen for chronic pain and inflammation. That was 70% of my patient population had chronic pain and inflammation. Yeah. And I was like, hey, I've got studies like this. You all take anti-inflammatories, whether it's ibuprofen, naproxen, there's the Vioxx and Celebrex and diclofenac and on and on. These. I said, let's try this. The studies are here. So yeah, slowly but surely got picked up. And then neuropathy. I had I had medical foods for neuropathy and Procura, and I was like, this is incredible. All I really have is gabapentin. Narcotics don't work well, you know. Half my patients are getting confused, falling asleep. I was like, let's try this. And I had really good results with Procura for neuropathy. And then for sleep, half my patients also chronic sleep problems. So this was studied against a big sleep med, and sleep with anxiety and sleep with depression. I had Centropm, I had Gabadone, and all these things were regulating different neurotransmitter pathways. And it was always clear to me neurotransmitters are the signaling pathways of the nervous systems that affect everything in the body. And everyone's autonomically dysregulated, you know, so because of stress in our society. So slowly but surely, you know, these became more and more a part of my practice. And again, some of my colleagues, you know, chairman of rheumatology at Cedars, who was another UCLA professor, you know, another friend who was the executive vice president of Herbalife, and also a Harvard-trained doctor who's now my chief medical officer and was a top concierge doc in the community. He's still regularly for 20 years prescribing these medical foods daily in his practice for everything, for obesity, pain, sleep, neuropathy. I mean, we have 9 products in this company that are incredible.
Yeah.
So, you know, I just hope that listeners open up to an option, no matter what they're taking, to tell their doctor, hey, I'd love you to look at, I'll speak to any doctor about it, show them the science and say, hey, why not make this available and give it a shot in your patient?
Yeah,
So,
I think it's brilliant. I love it. I'm actually on your website right now, Medical Foods. Is it medicalfoods.com? Is that the easiest place to find it?
Medical Foods. We kept it really simple.
Yeah, and so what I'm going to do for everybody listening is I'll link all of this in the show notes. We'll put some discount codes in there. We'll put some really interesting opportunities for you to get more information about these medical foods. And if there's a problem that you're experiencing, which, you know, I know I can list off 50 people right now that I know should be on, you know, the Theramine and the joint discomfort product and all of those. And so let me ask you a couple questions about this for the listener. Is this like a supplement that you would take daily, or is it is it like a pharmaceutical where you take it for 30 days, then you don't? That way they kind of get a better understanding of how to proceed.
That's a great question. So especially with Theramine, because we're meeting a deficiency of a neurotransmitter at a cellular level, right? We tell people, give it a try for at least 4 to 6 weeks with the Theramine, and some people respond much quicker. The sleep meds, I find some people responding much quicker for 2 at night, but it depends how deficient they were, right? I have people on Theramine now for chronic arthritis for 8 years and 10 years, no longer on anti-inflammatories, or taking a small fraction of what they took. So it varies. I tell people, give it a month or so, slowly start to decrease, you know, per your doctor, and communicate with your doctor if you're coming down on some pharmaceutical medications, right? And then it's not dangerous at all to stay on because they're all natural.
Right.
So like anything, I tell people, look, you could stay on this as long as you're having symptoms. Typically, people will give it a few months. If your body regulates after that, and you're eating well, and you're exercising, and all other things are settling down, great, come down it. We do have many people who stay on these because, again, they're meeting a nutrient demand at the cellular level. So I would say it's like a supplement in that it's safe to stay on, although there are certain supplements that have certain interactions. These don't have any drug interactions to speak of, which is great. So minimal side effects. You may get a little dry mouth. You may get a little fuzzier early on, but many people, and you could take 2 or 3 of them. So like I have people on Centra AM for fatigue and cognitive decline, and Theramine, and Centra PM for sleep. Like I have my fibromyalgia patients as a protocol: Centra AM in the morning, Theramine twice a day, Centra PM to sleep. Because most fibromyalgia people also have fatigue, and sleep difficulties.
Yeah.
And I've met people who've stayed on 3 of the medical foods for a long time. So
they can be combined for multi symptoms or for, daily use in order to, eliminate or minimize symptoms throughout the day.
exactly. And,
Beautiful.
again, I'm hopeful people will tell their physicians, hey, could you reach out to Dr. Sinel, Dr. Mike at medicalfoods.com, and let me educate the practitioners so they can bring it to their patients and let them guide any weaning of medications, because I've been educating practitioners on this, and that's a big goal.
Well, I think your approach and your philosophy is beautiful. Like if you were my doctor in Beverly Hills, like I would not have allowed you to, I don't know, you're not retired, but I would have forced you to stay there. You wouldn't have got to travel. You wouldn't have got to have any fun, because I think that you are exactly what the space, needs, because it's bigger than just a singularly focused approach. And I love your expansiveness, and you're willing to look at the body, not just treat the symptoms, but actually treat the actual human, which is great.
Thank you. Thank you.
Absolutely. So what I'm going to do, Dr. Mike, I'll put all the information in the show notes, make it really easy for the listeners to go and click the link, grab some of these. And my audience is very interactive. And so what I'll do is I'll answer all the questions that I'm in line to answer. And then anything else, I'll send them your website.
Right.
They can ask questions, they can get some feedback, and we can really make, as I know your purpose behind this is to help people and to get people to a better place. And so I think you and I combined can do a lot of good. So
I love it.
That'll be my mission, and I'll do that. Just spreading the word for you. So anything you want to leave the audience with before we take off for the day?
No, I mean, just want to thank you. You put out some great work. I've looked at it, love your book. And we're all working together to spread the health. So thank you. And I'm fully available. Any questions, any doctors want to speak, any health coaches, anyone, consumers, we have good customer service. So thank you very much.
Thanks for coming. Thank you for giving me the time and spending the time with us today. We'll see you soon, Doc.
Thank you. Take care.
Bye. Hey, before you go, I'd just like to say thank you again for listening to the Thrive Forever Fit podcast and watching on YouTube. It means the absolute world to me. And if you would do me one favor, and that is simply subscribe and review this podcast on whatever platform it is that you enjoy it on, YouTube, Apple, Spotify, doesn't matter. I would absolutely be so grateful and so thankful if you do that for me. Thanks again for listening, and I'll see you again next week with an awesome episode. Bye.